Okay, so we'll start with anterior leg muscles. So here's the anterior compartment, here's the lateral compartment, and then the leg, we also have the posterior compartment back here. So in the anterior compartment, we find muscles that primarily do dorsiflexion and also extension of the toes. So this first muscle here is tibialis anterior. You can see it starting on the lateral side of the tibia, and it goes all the way down to the medial aspect of the foot. So here's tibialis anterior. It goes to the first metatarsal and to the medial cuneiform. So when we pull on this muscle up towards where it starts, it does dorsiflexion of the foot. And also because it goes right to the medial side of the foot, it can help to do inversion of the foot. So if we tugged on this muscle, the sole of the foot would move medially. Next we have extensor digitorum longus. And if you follow this muscle all the way into the foot, you can see the 4 tendons of it here. Okay, so sometimes if you start at the tendon and then go up the other way, you can double or confirm that this is in fact the extensor muscle. So just like the name implies, it does extension of the toes, and because it also crosses underneath this retinaculum here into the foot, it's going to do dorsiflexion. Here we can see extensor hallucis longus. So here's the muscle, and it goes all the way down to the distal phalanx of the big toe. So again, the name tells you extensor hallucis longus, it's going to extend the big toe, and also because it goes anterior to the ankle joint, it does dorsiflexion of the foot. The last muscle in the anterior compartment is called fibularis tertius, and we can really only see the tendon of it here. So we know we only have 5 toes, and there's 6 tendons. 1, 2, 3, 4, 5, 6. So this last tendon here is for fibularis tertius, and this muscle is kind of an extension of extensor digitorum longus, and we can see it on the undersurface here, a little bit of it right here. Okay, so those are the 4 muscles in the anterior compartment. In the lateral compartment, we have just 2 muscles, fibularis longus and fibularis brevis. So here's fibularis longus. It starts on the proximal end of the fibula, and here's the tendon of it here. So imagine you could pick this tendon up. The tendon goes behind the lateral malleolus, and this one goes underneath the foot. So here's the tendon of it, and then it goes underneath the foot to the medial side of the foot. So we can't see exactly where it goes because on the bottom of the foot there are all the muscles on the bottom. Okay, and then here's fibularis brevis. So on either side, down here, this would be fibularis brevis. It starts on the distal end of the fibula. It goes down, and here's the tendon of it, stopping right on the 5th metatarsal. So both of these muscles, if we pull on them up towards where they start, they're going to cause the foot to drop or do plantar flexion. And because they go right to the lateral side of the foot, they also can do eversion. So the sole of the foot would move away from the midline. In the posterior leg, there are 2 compartments. We have the large calf compartment or superficial compartment, and then deep to it we have other muscles. So I'll first do muscles in the superficial compartment, and there are 3. So here we have gastrocnemius. It's quite large, and gastrocnemius has 2 heads. So we can look to the big toe to help orient you. This would be the medial head of gastrocnemius, and here's the lateral head of gastrocnemius. So both of these heads start up on the femur, on the condyles. Okay, so you can see exactly they're kind of crossing behind the knee joint here, and their fibers go down and attach into the calcaneal tendon, which goes down to the calcaneal tuberosity of the calcaneus. Okay, so here is this large calcaneal tendon right here. If we take off one of the heads of gastrocnemius, so if we take off the medial head, let's see if we can get it off. There we go. That's a tough one. So underneath gastrocnemius, here we have soleus, or part of soleus here. And in between gastrocnemius and soleus, we have plantaris, or the tendon of plantaris. Here's the muscle belly of plantaris, so it's very, very small. So soleus, we can see a little bit better from this view here. So soleus is the one that looks kind of like a fish. So here's the head of the fish, and here's the tail of the fish. And this particular muscle starts just on the tibia and fibula, so it's not crossing the knee joint. And it goes down into the calcaneal tendon as well. Whereas plantaris does cross behind the knee joint because it starts just above the lateral head of gastrocs. So here, if we follow this one up, it goes all the way up into behind the knee. Okay, so all 3 of these muscles share a common insertion, which it's not really connecting here, but it's the calcaneal, via the calcaneal tendon, they go down into the calcaneus bone. So all three of these muscles do plantar flexion, and gastrocnemius can also do flexion at the knee joint because it crosses behind the knee. In the posterior compartment, there are 4 muscles, just like the anterior compartment. So here we have one muscle here, which is called popliteus. So popliteus is the one that unlocks the knee, and it looks really quite large here on this particular model. This is the only muscle in the posterior compartment that does not do plantar flexion of the foot. Okay. The other ones, if we look to the medial malleolus, we can then find the tendons of the other 3 muscles. So the first tendon here is tibialis posterior. The next tendon is flexor digitorum longus. And then the last tendon here is flexor hallucis longus. So remember the saying Tom, Dick, Harry. And then we can follow the muscle tendon up and find out what muscle it is. So this one's Harry. So Tom, Dick, Harry. This is flexor hallucis longus, this whole muscle here. And it's starting on the fibula, and then it goes in the foot, and the tendon crosses over. They go into the bottom of the foot and goes all the way down to the distal phalanx of the big toe. So this muscle, the name tells you, it's called flexor hallucis longus. It flexes the big toe, and because it goes behind the medial malleolus and into the bottom of the foot, it also, when we pull on it upwards, it's going to cause plantar flexion. Okay, so this one was Harry, or hallucis. So Tom, Dick, this one's flexor digitorum longus. So it's starting on the posterior aspect of the tibia. It goes behind the medial malleolus and then into the bottom of the foot and goes all the way to the middle, or to the phalanges of digits 2 to 5. And then the last one here is just the tendon of tibialis posterior. And up here is the muscle belly. So tibialis posterior starts on the interosseous membrane. So it's in between. It also starts a little bit on the fibula and a little bit on the tibia. But the whole muscle belly is underneath here, and then here's the tendon. But most of the muscle belly is covered up by flexor hallucis longus and flexor digitorum longus here. So tibialis posterior, in addition to doing plantar flexion, when we pull on this tendon up towards where it starts, the foot will drop, do plantar flexion. And this particular muscle, where it goes in the bottom of the foot, we can't see exactly where it goes, but it goes right to the medial side of the foot, and therefore does inversion of the foot as well. So tibialis posterior and tibialis anterior both work to do inversion of the foot.